So at this time, you might have a regular doctor's appointment scheduled and you might be wondering whether or not you should go. Clinicians are prioritizing urgent and emergent cases at this time, and they are rescheduling elective cases. Your doctor may triage your case based on the severity of your case, your comorbidities, and your risk of developing COVID-related complications. Some skin cancers, including squamous cell carcinomas, basal cell carcinomas, and even some melanomas, are slow growing and can safely be delayed for a period of time during this pandemic. Other skin cancers or dermatologic conditions may pose an immediate risk to your health, and thus treatment should not be delayed. I always recommend calling your doctor's office before going to any visits or before canceling in order to understand your risk. Instead of canceling or delaying your care, your doctor may be able to offer you a virtual visit by phone or by video in order to optimize your care. If your doctor does determine your case to be urgent and you do need to keep your appointment, be aware of any protocols that are in place during COVID-19 at your clinic or hospital. During the pandemic, you may be screened for symptoms, you may be asked to wear a mask or other personal protective equipment, and there may be limitations on visitors and family members that you can bring to your appointment. Once at your appointment, there may be certain social distancing requirements that reduce your exposure to staff and to other patients. Also, your physician may be taking extra precautions, including wearing masks, personal protective equipment, avoiding shaking hands, and even doing verbal consent and signatures to avoid passing pens back and forth. If you have a severe dermatologic condition or a complication from a procedure, please do not go straight to the ER. First, ERs are high-risk areas for COVID-19 transmission. Second, the emergency room needs to be reserved for the most critically ill patients during this pandemic. Please contact your physician first before heading to the emergency room. Lastly, during this time, some medications may be in limited supply. If you are concerned about your access to certain dermatologic medications, please contact your doctor.